Hi, I'm Dr. James Machino. What is erectile dysfunction and impotence in men? Well, erectile dysfunction is defined as a consistent inability to obtain and maintain an erection for satisfactory sexual relations. And some people have complete erectile dysfunction, which is an inability to have penetrative relations at any stage. So that's sort of complete impotence, if you will. How common is the problem? Well, surprisingly, 50% of men by the age of 50 have some degree of erectile dysfunction, and by age 60, 75% of men have some degree of erectile dysfunction. They may not have complete erectile dysfunction or complete impotence, but they have some difficulties in terms of their ability to sustain an erection or have the penetration that's required for a satisfactory period. So what are the causes of this? Well, one of the main causes is that after the age of 40, there's a 1% decline in testosterone blood levels. So between age 40 and age 70, your blood levels of testosterone decline by about 30%, about 1% per year. So that's a factor. Another factor is that if your blood vessels are slowly getting clogged up with cholesterol plaque because your diet hasn't been great, then the clogging of the arteries that lead to the genitalia can actually impede blood flow there, and that can be a problem. So you want to keep your total cholesterol below 3.9 millimoles per liter or 150 milligrams per deciliter. They're both that'd be the same level, just different units. And diabetics have an increased risk for erectile dysfunction because diabetics have a greater propensity for cholesterol plaque to clog up their arteries and stop blood flow to many different areas of the body, including the genitalia. So for diabetics, for the standpoint of a heart attack and stroke risk and other problems, they have to keep their total cholesterol below their LDL cholesterol in particular, below 1.8 millimoles per liter, because it's a risk for diabetics to have vascular disease. But diabetes increases risk of vascular dysfunction with respect to blood flow to the genitalia. Alcohol consumption is linked to erectile dysfunction problems as well, as are psychosocial factors, like if you're having relationship problems, obviously, lack of attraction to your mate, or just the stress of life, which can beat you up from time to time, can really decrease not only your libido, but your ability to even perform sexually. So these are things that are a bit obvious. But also if you have an enlarged prostate gland, that's related to a decreased problem or an increased likelihood of having erectile dysfunction problems. And in the aging process, the actual nerve receptors around the glands of the penis, there are a fewer number of them over time, so it takes a greater amount of sensation to stimulate those glands in order to get an erection. So there's fewer of these mechanoreceptors that can actually stimulate the nerves that would lead to an erection. And you might want to know that there's a number of medications that can actually that are shown to be linked to an increased likelihood of erectile dysfunction. So I discuss the drugs in a different video that's available on the websites. But in terms of the treatment, what are the medical treatments for erectile dysfunction? There are drugs like Viagra and Cialis and Levitra. I'm sure you've heard about them. And what they do is they stop the breakdown of a chemical in the blood vessel wall that allows the blood vessels to remain dilated, so more blood will stay in there, there'll be more engorgement, and you have a better erection. So by inhibiting what's called the breakdown of cyclic GMP, these drugs tend to work. The problem is that they tend to cause this dilation effect or opening of the blood vessels across all of the circulation of the body, more than what is intended. And that can lead to a sudden drop in blood pressure, which then the heart can start struggling to maintain blood flow through the body, and there are reports of some cardiovascular complications. So the Cedars-Sinai Hospital study, which reviewed 1,400 adverse events related to the use of Viagra, showed the number of men that were having cardiovascular complications from using the drug, and of which one of the outcomes was actually sudden death, hours after taking Viagra. So there are some concerns. That was published, by the way, in the Journal of the American College of Cardiology in February 2000, in case you want to look it up. So I have some concerns about Viagra and Cialis, Levitra, and drugs like that. Medical doctors sometimes prescribe testosterone replacement therapy, which I have a concern with as well, because if you have any prostate cancer cells in your prostate gland that are just lying there dormant and not bothering you, as a lot of men do by the age of 50, that testosterone can act like fertilizer and cause those cancer cells to start growing, and now you have a clinically significant prostate cancer. So I'm not in favor of doing that, to be quite honest with you. What's really underappreciated are the natural remedies that are safe and effective for improving erectile dysfunction. So the combination of certain herbs like Tribulus terrestris, Muira puama, Avena sativa, maca root, Damiana root, epimedium herb, when you put those together, they have a synergistic effect that can increase blood flow to the genitalia, increase sensitivity of the penis and the glands around the genitalia, and also increase libido and desire. In fact, some of these effects are actually useful even for women who report more sensitivity and easier time reaching orgasm and having more sexual desire. So these herbs are for both men and women, but clinical studies have proven their efficacy in helping to reverse erectile dysfunction problems in men. And they're not being utilized to the degree that makes sense, because the drugs tend to take more of the limelight. But the herbs are actually safer in my view. But there are some dangerous supplements that I don't think men should use to correct erectile dysfunction. So there are some really great and safe supplements, and then there are things that are actually dangerous. Anyway, I've explained it all, everything you need to know about improving erectile function and maintaining better sexual performance and libido and desire. I've explained it all in an ebook that's available here called Effective Natural Remedies for Sexual Performance and Libido, a guide for men and women. So if you're having any erectile dysfunction issues or libido issues, or maybe the female in your life is having problems around sexual desire, you should really download that ebook right now. It's available right here, and it has all of the sort of the story as to how this all works with all the scientific references, so you know you're getting only sound, solid information from me on this subject. But it can be very useful, and it's a major quality of life issue as well. Now remember that at machinohealth.com, you can also see my other research review papers, other videos I've created, footage from my live professional seminars, as well as other downloads and resources I've created, all there to help you lead a long, healthy, functional life. And so all the research review papers and my teaching materials have all the scientific references in them to make sure you're getting only sound scientific information on any health topic that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.